Hello, my name is Kathy Quarles-Moore, and I'm an associate professor at the University of South Carolina College of Pharmacy. I'm also a practicing independent community pharmacist, and today I'm going to be guiding you through some of the top 300 drugs that we use in community pharmacy.
In this section, we'll be talking about CNS drugs. These act on the central nervous system, and some medications you might be familiar with would be maybe benzodiazepines, which includes Xanax, Valium. However, this is just a small multitude of different uses for these medications. Other uses for these medications may include things such as ADHD, ADD, Parkinson's disease, and even such things as pain management. Moving along to the 5-HT3 antagonist antiemetic, we're going to talk about ondansetron. And the brand name for this is Zofran or Zofran ODT. You know what the ODT stands for? Oral dissolving tablet. Pretty cool stuff, so you just can sound it out. It took me a while to realize that was what it stood for, but I figured it out, okay? An indication for this would be nausea and vomiting. This is a very good tablet for nausea and vomiting. The side effects would be constipation or headache. One thing about this is it can increase the risk for serotonin syndrome potentially, and it can also contribute to QTc interval prolongation, so you would avoid with other prolonging agents. That's important too. Acetylcholinesterase inhibitors. Donepezil. The brand name is Aricept, and it also comes in a patch. And this is used for Alzheimer's disease. The side effects of the donepezil would be nausea, diarrhea, and we need to take it at bedtime because this will help decrease the nausea that is possible with the side effect of this drug. And if you look at the warnings and contraindications, cardiac effects, bradycardia, and QT prolongation. So important to note that with your patient or your patient's agent in this case specifically. All right, another acetylcholinesterase inhibitor would be rivastigmine. The brand name is Exelon. It is also used for Alzheimer's disease, and it has the same side effects. The nausea and the diarrhea and the warnings and contraindications are the same. A quick note for this is they also make a patch with this, and the patches change daily. Rotate the sites and don't repeat a site for 14 days. And you apply it to the upper, lower back, upper arm, or chest. One other note is this is used for Alzheimer's, and so is donepezil, but the anticholinergic medications can decrease the efficacy of donepezil. That's important. P.S. Let's talk about barbiturate's non-opioid combination for tension headaches. Here we have butalbital, acetaminophen, and caffeine. The brand name is Fioricet. Now let's break this down for a minute. The set would be the acetaminophen portion. And the butalbital, I'm not going to say Fior is butalbital because how can you get Fior out of butalbital? You can't. But just remember the set because you're going to have one that's Fiorinol and there's a little difference there. So just remember set, acetaminophen. The indication is for tension headaches. The side effects would be abdominal pain, nausea and vomiting, dizziness, and fatigue. But you can take this one with food to decrease stomach upset. And remember, with this one, you might want to make sure if somebody is taking this drug, let them know that this contains acetaminophen because they can get too much. You don't want to have them take too much because that could cause hepatotoxicity. 5-HT1 agonist acute anti-migraine agent. Amitriptyline. The brand name is Relpax. Its common indication is a migraine. Some of the side effects would be tingling, numbness, and tryptophan sensations, which would be pressure in the chest or the neck. Now, this drug you can repeat. If it doesn't help the headache subside in 2 hours, you can repeat it one time if need be. Some of the warnings or contraindications for this would be uncontrolled hypertension, cerebrovascular disease, and use of another triptan within 24 hours. Very important here. Another one would be rizatriptan. The by-mouth version is called Maxalt, and the ODT, remember what ODT stands for? Oral dissolving tablet, Maxalt, MLT. And if you look, its common indication is the same, migraine with the same side effects and with the same warning and indications. You can repeat this dose in 2 hours if you need it. Another one is sumatriptan. Now, this comes in several different dosage forms. PO, the by mouth, the nasal spray, and the subcutaneous injection. The brand name is Imitrex, and it is also indicated for a migraine with the same side effects and the same warnings and contraindications. And you can still repeat this dose in 2 hours if you need to. Let's talk about anticholinergic agent for overactive bladder. Solifenacin. The brand name is Vesicare. Its common indication is used for urinary incontinence, but some of the side effects would be drowsiness, dry mouth, dizziness, and constipation. So it's contraindicated in uncontrolled narrow-angled glaucoma. Let's talk about an anticholinergic agent called scopolamine. It's a patch. It's called Transderm Scop. So this really tells what it is. The scop is the scopolamine, and the transderm means it's applied transdermally. Isn't that cool? Transderm Scop. And it's indicated for motion sickness. You know, these are the patches that you wear behind your ear a lot of times when you're going on a cruise or a trip. Its indication is for motion sickness, and some of the side effects would be dry mouth, CNS effects, increased intraocular pressure, and fatigue. Now, this drug, you need to apply it 4 hours before you need it, and you replace it every 3 days if you need it. One of the contraindications is contraindicated in closed-angle glaucoma, and also those who have a hypersensitivity to belladonna. There's an anti-vertigo agent called meclizine. The brand name is called Antivert, and its common indication is vertigo or motion sickness. This came out before the Transderm Scop, and so we use this a lot for travel. And this one you take 1 hour before you travel, not 4 hours like the Transderm Scop. But some of the side effects would be dry mouth, CNS effect, and blurry vision. And this one could cause CNS depression and increased intraocular pressure. Let's talk about an antileptic C5, that's control 5. Anytime it's a C and a Roman numeral, this is C5. That means it's controlled or scheduled. And remember what the schedules are. The more propensity they have to be abused, the higher the schedule. So a C5 is abused, has a potential for abuse, but not as much as a C2. Are you with me on that? Good. Okay, let's talk about lacosamide. The brand name for lacosamide is Vimpat, and the common indication is for seizures or epilepsy. The side effects would be dizziness, headaches, blurry visions, and you want to make sure that you know a warning and contraindication. It can prolong the PR interval and increase the risk of arrhythmias. That is good to know. Another anti-epileptic drug is Carbamazepine. The brand name is Tegretol, Tegretol XR, and Tegretol. Common indications, seizures and epilepsy. And here again, we have the same side effects, dry mouth, CNS effects, and blurry vision. Now, this one has a black box warning, which says serious skin reactions possible. Stevens-Johnson syndrome is a possibility. Aplastic anemias, agranulocytosis are possible, all possible while using this. And it's also contraindicated when a patient's myelosuppressed. So that's important to know. Now, another important counseling point is it's a CYP3A4 inducer, which means that it may decrease the concentrations of hormonal birth control. You got to tell your patients that for sure, especially if they're taking birth control pills. Okay, lamotrigine. The brand name is Lamictal. And you remember that lamb. But I think if we remember lamotrigine, Lamictal, we kind of equate the two. The common indication for this is, of course, like the others, seizures and epilepsy. Now, some of the side effects, alopecia and rash, and this is why the dose needs to be titrated up to reduce the risk of severe rash. So you got to make sure you start low and ease it up. Your black box warning has serious skin reactions possible. And also, one thing about lamotrigine, it could be associated with blood dyscrasias, so that's important. Another anti-epileptic is levetiracetam, or brand name Keppra. All right, and a common indication, again, is seizures and epilepsy, side effects, dizziness, psychiatric disturbances, and somnolence. There are really no significant drug interactions with this drug, but there's a possibility, a black box warning with serious skin reactions, and this could cause some psychiatric disturbances. Another antiepileptic is oxcarbazepine. The brand name is Trileptal. Common indication, again, is seizures and epilepsy. Some of the side effects, dizziness and somnolence. This drug can also possibly decrease the concentration of birth control hormones. So you need to let your patients know that. And there's some serious skin reactions possible, like we talked about earlier, Stevens-Johnson syndrome, and the possibility of hyponatremia. So be advised with this one and let your patients know. These are things you need to tell them. Another antiepileptic is phenytoin. The brand name is Dilantin. Common indication, again, seizures and epilepsy. The dose-dependent side effects would be nystagmus, diplopia, and ataxia. Chronic side effects would be gingival hyperplasia, hepatotoxicity, and hair growth. One of the contraindications is that you could get the serious skin reactions like we've talked about before, and the drug may cause fetal harm. This, too, may decrease the concentrations of birth control pills. An antiepileptic hypnotic C4. Remember that C is controlled, schedule 4. So this has a little more abuse potential than the lacosamide, which was a C5, right? Remember? So this is phenobarbital, and the brand name is Cezabie. Cezabie, like open sesame? Nah, Cezabie. It's for seizures and epilepsy. And some of the side effects is that you can get a tolerance built up to this drug. You can also have a hangover effect, dizziness, and somnolence. Now, a black box warning, which is important and significant. If you use these with opioids, they could cause really serious sedation. You could be very tired. And you can become dependent on this drug. So make sure that you let your patients know this may be habit forming. And this, too, could potentially lead to respiratory depression, and it may cause fetal harm. A lot of drug interactions with phenobarbital. It's a strong inducer of many enzymes, so you got to watch that. Next, we have the antiepileptic migraine prophylactic drug, which is topiramate, Topamax. You see where we're going with this? Topamax, topiramate, and it's for seizures and epilepsy, and also they use this a lot for migraine prophylaxis. Now, an interesting thing with this one, it can cause weight loss. People started using this for their migraines, and they started losing weight, and they didn't want to get off of this, okay? So just note to self, this could cause that, and it can also cause some anorexia, which is potentially the reason they lost the weight. It also causes really, and I have seen this in patients, trouble with memory and concentration and attention. But the memory is a big thing. That happens fairly often, so be aware and let them be aware. This drug could cause metabolic acidosis, visual problems, fetal harm, and you got to just remember that, okay? But the main thing I think with this drug is the side effects. And note, this can also cause the decrease of concentrations of hormonal contraceptives. So advise your patients. Okay, let's talk about an antiepileptic mood stabilizer, divalproex sodium. Divalproex sodium, valproic acid. The brand names Depakote, Depakote ER, Depakote Sprinkle, and Depakine. It's used for seizures and epilepsy. Some of the side effects can be weight gain, alopecia, and nausea and vomiting. This drug is potentially hepatotoxic. It can cause pancreatitis, and it's also notably can cause fetal risk. So you need to make sure your patients are aware of this. Antimanic agent, lithium carbonate, Lithobid. Now, lithium, Lithobid. What do you think the brand name Lithobid? Why did they name it Lithobid? Let me tell you, I'm dying to tell you. So this is the reason they call it Lithobid, because it's lithium, the lith, obid, bid. Why do they get the bid? BID is twice a day dosing. Get it? Pretty cool. It's used for bipolar disorder. It can cause some stomach upset, some cognitive effects, cogwheel rigidity, tremor, and hypothyroidism. This drug can actually cause also, it's not on here, but can cause some weight gain. A lot of people would stop taking it because it did cause weight gain. But that is not in here, but I'm just telling you right now, it can. You can also, increased lithium levels, and they need to be monitored to avoid toxicity. That's very important. And the possibility of serotonin syndrome. So we need to know all of these things with this drug. We have something that's called a GABA analog, anti-epileptic neuropathic analgesic. It's called gabapentin. And GABA, their receptor is called GABA in the body, GABA analog, and the brand name is Neurontin. Neurontin, neuropathic? Do we see a relation there maybe? So the indication is neuropathic pain relief and epilepsy. The really cool thing about this drug is it was indicated for epilepsy a long time ago, but then they started realizing it was helping neuropathic pain. Neuropathic pain, Neurontin. Yes, that's really good. So that's what they use it for a lot now. I don't see it as much for epilepsy now, but they do use it quite a bit for the neuropathy relief. Some of the side effects are dizziness, somnolence, peripheral edema, weight gain, and mild euphoria. This drug is not controlled. Another GABA analog, anti-epileptic neuropathic analgesic, notice this, C5, is controlled. And does that name look familiar a little bit? It's got the GABA in there, but it's the pregabalin. Interesting. This is controlled, but the gabapentin is not. The brand name is named Lyrica, and this one's for neuropathic pain, epilepsy, as well as fibromyalgia. And some of the side effects would be dizziness, somnolence, peripheral edema, weight gain, and it's a mild anxiolytic, okay? So just note that this one is controlled. The abuse potential for this one is higher than the one for gabapentin. But there is conversation about gabapentin becoming controlled too. Just a little tidbit I threw in there. Don't know if it'll happen. It's just been talked about. Let's talk about serotonin 5-HT1A receptor partial agonist anti-anxiety agent, Buspirone. The brand name is Buspar. And you can remember that because the BUS, the bus. Some people call it Buspirone, Buspar. I think it's Buspirone, Buspar. Tomato. It's used for anxiety, and it has some side effects. Drowsiness, dizziness, nausea, and it's also got an increased risk of serotonin syndrome when it's used with other serotonergic drugs. You got to be careful of that. And if you're taking a monoamine oxidase inhibitors, you don't use this within 14 days of that. All right, let's talk about the first generation H1 antagonist anti-anxiety relief from itching. Hydroxyzine hydrochloride, Atarax. Indication is anxiety, itching, and hives. It's got some anticholinergic side effects, and it can also cause QT prolongation. Let's talk about those anticholinergic side effects. What would they be? Anticholinergic is anything that can cause drying of the eyes, the mouth, the nose. So it can cause constipation, dry mouth, dry eyes, blurred vision, etc. And drowsiness. Did I say that? First generation H1 antagonist anti-anxiety relief from itching. Here's another one. But the cool thing is, this is a different salt. This is hydroxyzine pamoate. The brand name of this is Vistaril. It can be used for anxiety, itching, and hives, but this drug tends to be used more for anxiety and sleep. This has the same side effects, but it's generally used for anxiety, and it's typically used for a short amount of time. An anticholinergic anti-Parkinson agent that I want to talk about is Benztropine. The brand name is Codeine. The common indication is Parkinson's disease. Some of the side effects would be anticholinergic effects, and we just talked about those. Y'all remember? Blurred vision, dry mouth, dry eyes, constipation. Yep, you got it. And QT prolongation. Decarboxylase inhibitor, anti-Parkinson agent. This is something, it's a combination drug. It's Carbidopa, levodopa. The brand name is Sinemet, and it's used, the common indication is Parkinson's disease. Some side effects of this drug, nausea, dizziness, orthostasis, dyskinesia, and psychosis are common with this particular drug or this combination of drugs. Dopamine agonist anti-Parkinsonism restless leg agent, pramipexole, or the brand name Mirapex, Mirapex ER. Common indication is Parkinson's disease, restless leg syndrome. And I see this a lot for restless leg syndrome. I see it probably more in my practice for restless leg syndrome than Parkinson's disease. Not to say it's not, but I see it a lot in my particular practice used for restless leg. Side effects: nausea, dizziness, vomiting, and dry mouth. This is one of those drugs that you don't need to discontinue quickly, so you need to get off of this gradually. This drug, interestingly, can cause some hallucinations. That is important to know, and some orthostasis. Another dopamine agonist anti-Parkinsonism restless leg agent, ropinirole. Ropinirole. Can you say it? Ropinirole. The brand name is Requip. Common indication is Parkinson's disease, restless leg syndrome. And I think if we think about this, let's look at the restless leg, Requip. Restless leg, Requip. Okay? Side effects would be nausea, dizziness, vomiting, and dry mouth. And again, hallucinations and orthostasis are potentially problems. Don't discontinue this one abruptly either. Now, this is a drug that's been around a while, and it's a first-generation typical antipsychotic. The generic name is prochlorperazine. Say that fast 3 times. Prochlorperazine. The brand name is Compro, and it's used for nausea and vomiting. It used to be used a lot as an antipsychotic, but really it's better for nausea and vomiting. The side effect, it can have acute extrapyramidal side effects, sedation, and lethargy. And it actually can exacerbate the symptoms of Parkinson's disease. So we need to be really aware of that if somebody were to give this for nausea and vomiting and somebody has Parkinson's syndrome or Parkinson's disease. We need to say, nope, this is not the drug we would like to use, and for the reason. Second generation atypical antipsychotic anti-manic agent, olanzapine. The brand name is Zyprexa. The indication is for schizophrenia and bipolar disorder. Some of the side effects would be somnolence, metabolic syndrome or weight gain, and some extrapyramidal side effects or symptoms. And smoking with this drug actually reduces the drug levels. That is very important to talk to your patients about. Here's a second-generation atypical antipsychotic anti-manic agent, quetiapine. The brand name is Seroquel. The indication is schizophrenia, bipolar disorder, and here you have the same side effects: somnolence, metabolic syndrome with weight gain, and extrapyramidal symptoms. And if you're taking the Seroquel XR, it really needs to be taken at night. Here's another one, risperidone. The drug is named Risperidol, and Consta. The common indication would be schizophrenia and bipolar disorder. Side effects: hyperprolactinemia, but we have metabolic syndrome with weight gain and extrapyramidal side effects. Second generation atypical antipsychotic, Zyprexa, and the brand name is Geodon. The common indications would be schizophrenia and bipolar disorder. Some of the side effects would be somnolence, dizziness and nausea, and extrapyramidal side effects or symptoms. This drug can cause prolonged QT intervals, so you don't use it in high-risk patients. That is important. You'll have an interaction that pop up all the time, so be apprised of that. Here's another second-generation atypical antipsychotic, Lorazepam, or Latuda, which is the brand name, indicated for schizophrenia and bipolar disorder. Side effects: somnolence, nausea, extrapyramidal side effects, and metabolic syndrome. Another second-generation atypical antipsychotic anti-manic agent is Aripiprazole, and the brand name is Abilify, and an indication is schizophrenia and bipolar disorder. Some of the side effects would be weight gain, akathisia, and it can be activating or sedating. So just note that, Aripiprazole. I just like saying that. Okay, here we go. Let's get into some benzodiazepines. Benzodiazepines, notice that Z, anti-anxiety, C4. Remember, what's the schedule mean? If you said potential for abuse, you would be correct. So Alprazolam, benzodiazepam, the Z and the Z. The brand name is Xanax. And common indication, it's for anxiety. Some of the side effects would be somnolence, dizziness, ataxia. And it's important to avoid alcohol with this one. It says avoid alcohol and pregnancy while using benzodiazepines, and that is true. This increases the risk of sedation. This is black box warning. Respiratory depression, coma, and death, especially with opioid use. So that is very important. If you have somebody that's got a benzodiazepine and they're also taking opioids, we need to counsel them for a while on this, okay? And we need to let them know that the risk of respiratory depression is increased. There's also a risk of abuse with this drug. It's a C4, and also withdrawal symptoms with abrupt discontinuation are possible. So if they've only taken it for a little bit, maybe not, but if they've taken it for a while and they decide they want to get off of it, which I've had happen, somebody's taken it for years and decide they don't want to take it anymore, you need to caution them and say, listen, you don't need to withdraw this right away because we can have some major problems. Also, patients older than 65 years old might need to be very careful because it's a safety risk for them with this drug. Okay, here's another benzodiazepine, still Schedule 4. It's called Clonazepam, and it's indicated for anxiety too. The brand name is Klonopin. Clonazepam, Klonopin. Those sound alike, don't they? So that's easy to remember, Clonazepam, Klonopin. Sometimes that might get you mixed up. Klonopin's the brand name, Clonazepam's the generic name. And the side effects would be somnolence, dizziness, ataxia. And again, you've got the same black box warning and the same drug interactions and quick notes. Avoid alcohol with this one. Another benzodiazepine, Schedule 4, is Diazepam. Diazepam, Clonazepam, Alprazolam. You notice all these azepams? Benzodiazepines. Are you getting the connection there? I hope you are. That's good. Common indication, anxiety, side effects, somnolence, dizziness, and ataxia, along with all the same side effects, quick notes, black box warnings, and warnings and contraindications. Another benzodiazepine, Lorazepam. All these should be sounding quite a lot alike. It's indicated for anxiety. The brand name is Ativan, Lorazepam, Ativan. I think that A in there, Ativan, Lorazepam, and Ativan, has the similar side effects, black box warnings, and contraindications. So just note that all of them do. Another one is Temazepam. Now this one is used for anxiety, but we mostly see it used for sleep. Brand name Restoril, mostly used for sleep. I probably should have put sleep first, then anxiety. The side effects are somnolence, dizziness, ataxia, and complex sleep-related behaviors. There's a safety risk for patients greater than 65 years old. And sometimes with older folks, this may not be the best choice for sleep for them, but it does seem to work. And I think if they're monitored, we might be okay. But I think that's important to just kind of note the age of the patient. And it can also have some additive effect with other CNS depressants. So we have a drug, the generic name is Atomoxetine, and the brand name is Strattera. The indication is for ADHD. It's a non-central nervous system stimulant, and it's used for ADHD. The one black box warning that's very important about this drug particularly is it has a risk of suicide ideation. Some of the side effects would be dry mouth, decreased appetite, insomnia, somnolence, and hypertension. So now we're going to go to some CNS stimulants. This is Dexmethylphenidate. The brand name is Focalin XR, and the indication is for ADHD. Some of the side effects would be the same as the Strattera: decreased appetite, insomnia, weight loss, headache, and irritability. It does have a higher potential for abuse because if you notice, remember we talked about controlled scheduling? This one is a Schedule II drug. Another drug that looks similar to the dexmethylphenidate is methylphenidate, so it should look familiar. The brand name is Concerta, Ritalin, Contempla XR, Quilichew, which comes in extended release ER or chewable. Contempla, by the way, is an oral dissolving tablet. This is also used for ADHD. It is also, just like the dexmethylphenidate, it's a Schedule II drug, so it has a higher potential for abuse. Side effects are exactly the same as the dexmethylphenidate. Another drug that is a CNS stimulant used for ADHD is amphetamine, dextroamphetamine, and the brand name is Adderall XR and Mideas. Again, it is also used for ADHD. It is a controlled Schedule II. So it does have a potential for abuse, and it has very similar side effects: decreased appetite, insomnia, weight loss, headache, and irritability, just like the methylphenidate and dexmethylphenidate. Another CNS stimulant used for ADHD is Lisdexamphetamine, and the brand name for this drug is Vyvanse. And again, like I said, it's for ADHD. Side effects, same as the other CNS stimulants: And it also is a Schedule II, so it has a high potential for abuse. Now, this is a CNS stimulant, modafinil, and the brand name is Provigil. It's a CNS stimulant, but it's used for narcolepsy. And I want you to look at something. It's a scheduled drug, but it's a Schedule IV drug. Some side effects of this drug are insomnia, which you would think because it's used for narcolepsy, and severe rash, Stevens-Johnson syndrome, and headache. A muscle relaxant, which is Carisoprodol, brand name Soma, Schedule IV. Remember, that does have a potential for abuse, but not as high as a 2. And the indication for Carisoprodol or Soma is muscle pain and spasm. Some of the side effects would be drowsiness, dizziness, and confusion. Here's a CNS stimulant used for weight management. It also is scheduled, but it's a Schedule IV. Phentermine, brand name is Adipex P. And it's indicated for weight loss. Some of the side effects would be tachycardia, agitation, and increased blood pressure. And it is contraindicated in cardiovascular disease. That's very important. Another muscle relaxant, Cyclobenzaprine, brand name Flexeril, has the indication, just like Carisoprodol, of muscle pain and spasm. Side effects would be drowsiness, dizziness, confusion, and muscle weakness. Use this with caution if you're drinking alcohol. Important counseling point. Tell your patients. Alpha-2 adrenergic agonist used for muscle spasms. Tizanidine is the generic name for the brand name Xanaflex. It is used for muscle pain or spasm, and some of the side effects would be drowsiness, dizziness, confusion, hypotension, and muscle weakness. And this too should be cautioned with alcohol use. Baclofen is a muscle relaxant. Brand name is Lioresal or Lioresal. My southernness kind of comes in. Lioresal, Lioresal, tomato. Indication for muscle pain or spasm. And the side effects would be drowsiness, dizziness, confusion, muscle weakness, and headache. There again, you've got another cautionary note with alcohol. Methocarbamol, brand name is Robaxin, and it's indicated for muscle pain and spasm. It also has the same side effects as the other muscle relaxants: drowsiness, dizziness, confusion, muscle weakness. And this one, you have to be careful using it in older folks. Moving along to some narcotic opioid analgesics, if you notice, methadone, brand name Dolafine or Methadose, is a Schedule II, which means what? Yes, that it has a high propensity for abuse. This is used for pain, and some of the side effects would be somnolence, constipation, nausea, vomiting, dizziness, lightheadedness. This drug also could maybe have some additive effects with other central nervous system depressants. And really, you should avoid alcohol with this drug. A lot of these drugs are going to be very similar with their CNS depression and abuse potential because they're Schedule II. Buprenorphine and Naloxone, that's a combination drug. And the brand name is an oral dosage form and a sublingual dosage form, which is a film. Suboxone or Subsolve. Indication is for opioid abuse. Some of the side effects of this are very similar to the opioids themselves: somnolence, constipation, nausea, vomiting, dizziness, lightheadedness. One of the black box warnings for Suboxone or buprenorphine, naloxone, respiratory depression, abuse and misuse. This one actually is a Schedule III, so it's a step down from our Schedule II, which has a higher potential for abuse? Right. Here we have an opioid partial agonist opioid analgesic, which is also a Schedule III, control Schedule III. This is buprenorphine, which is very similar to the one we saw before, but it's not a combination drug. This has the oral dosage form Belbuca, and the patch is Bustrans. And this is used for opioid abuse as well, but it's not the combination like the one previously. Some of the side effects are the same though: somnolence, constipation, nausea, vomiting, dizziness, lightheadedness, and sometimes you have a little bit of a reaction at the application site. So be aware and let your patients know if they start breaking out in a rash, they need to let somebody know, like you or the practitioner. The next drug we're going to talk about is a narcotic opioid analgesic, and it's a Schedule II, fentanyl. The patch is the only dosage form that we have available legally, and its brand name is Duragesic, and it's indicated for pain. Side effects: somnolence, constipation, nausea and vomiting, dizziness and lightheadedness. And this one also can cause some patch site reaction. One thing you need to tell your patients about this particular patch, it's very, very important, is how to apply it on a hairless area, and also when they take it off. Usually they use it every 3 days. When they take it off, they need to take it off and fold it in half before they discard it, because pets and children could get in the trash can, or somebody else, and they could have a big problem. So make sure that is a huge counseling point for your patients. Another narcotic opioid analgesic, which is a class 2, schedule 2, morphine sulfate, brand name MS Contin, and it's used for pain. Side effects would be somnolence, constipation, nausea, vomiting, dizziness, and lightheadedness. This also can cause respiratory depression, abuse, and misuse, and it can lead to coma or death. So you've got to be very careful with this and tell your patients. Another narcotic opioid analgesic, class 2, is hydromorphone, the generic name for the brand name Dilaudid. Now, you might notice that morphone and morphine have similar roots, and they do. This is more powerful or stronger than morphine, hydromorphone. It has the same side effects as the morphine, but it also can cause respiratory depression, coma, or death, so you've got to be very careful to let your patients know this. It is very potent and very powerful. It really leads itself to a high risk for overdose. Another drug that's a narcotic opioid analgesic, also a Schedule 2, used for pain, is oxycodone, brand name Xtampza, OxyContin, and roxicodone. If you notice, these all have the same side effects because they're in the same class, okay? And they all can lead to respiratory depression, coma, or death. These drugs, the opioids, are the ones that we need to dispense Narcan along with, so the patients can have this at home in case there is an overdose. And I suggest more than one, probably 2. Another narcotic opioid analgesic combination, which is also a Schedule 2, is oxycodone APAP. That APAP is acetaminophen. Acetaminophen. So look at the brand name, Percocet. See that set, acetaminophen, and oxycodone. That's how you can remember that. It's also used for pain with very same side effects as the other opioids. Here's another narcotic opioid analgesic combo, which has a schedule of a 3. And if we remember, is the 3 higher abuse potential or less abuse potential than a 2? Less abuse potential than a 2. You are correct. The generic name is Codeine with acetaminophen, or APAP. The brand name is Tylenol with Codeine. It's used for pain. And if you notice, it has some of the same side effects as the other opioid analgesics. It also has the black box warning of respiratory depression and abuse and misuse. And it's also, one important thing, it's contraindicated in children under 12 and children under 18 who have recently had a tonsillectomy or adenoidectomy. And notice with this drug, you really have to talk about your acetaminophen maximum dose. That's important. Sometimes these folks that get this drug don't think about the acetaminophen component in it. So it's up to us as pharmacists to educate and make sure they don't go over that 4,000 milligrams per day. It really should be 3,000, but Lexicomp says 4,000. So I'd err on the side of caution. Another narcotic opioid analgesic combo is a class 2, which means it has a high abuse potential. Hydrocodone acetaminophen, and the brand names are Norco, Lortab, and Vicodin. It's indicated for pain. Side effects like the other opioid analgesics, you see them exactly the same. Potential for respiratory depression and avoiding alcohol. And remember, this has got acetaminophen in it, just like we've talked about before. Here's another narcotic opioid analgesic combo, which is a class 2. Its brand name is Tussianex. The generic name is hydrocodone chlorpheniramine polystyrex. This is a cool medium that this drug is in, the polystyrex medium. So it can be used for pain, but more importantly, it's used for cough. This drug has to be shaken extremely well. It's a liquid and it's shaken up. They tell you shake it sharply because you need to make certain that it's mixed. It's given every 12 hours and no sooner than that. The side effects are just the same as the other opioid analgesics: somnolence, constipation, nausea, vomiting, dizziness, lightheadedness. And you are to tell your patients to avoid alcohol. Another narcotic opioid analgesic, which is a class 4, less abuse potential than a 2 or a 3. The generic name is Tramadol, and the brand name is Ultram. Look at that. Tramadol, Ultram is the brand name. It is used for pain, and it has the same side effects as the other opioid analgesics. So make sure that you tell your patients this and make sure you direct them on their side effects and counsel them well about avoiding alcohol. And also, you don't want them to take it with codeine because it can actually increase the central nervous system side effects. Important. And we avoid this in children under 12. We're going to central nervous system section 3. Let's look at some antipyretic non-opioid analgesics. The first one is acetaminophen, or APAP, and we've talked about this before. The brand name is Tylenol. The common indication is for pain or fever. The counseling point with this drug is patients need to know that it can cause hepatotoxicity with doses greater than 4 grams per day. 4 grams per day would be how many milligrams? 4,000, yes. So remember, the drugs over the counter, you really need to look at that. People sometimes think that Tylenol or acetaminophen is just an everyday you can take as much as you want, but it's up to us to educate. No, that's not exactly true. And we really like to recommend a lower dose maximum of less than 3,000 milligrams a day to avoid this. Another non-steroidal anti-inflammatory drug, or an NSAID, you'll hear me say that a lot, is Diclofenac. There's a topical and a tablet called Diclofenac sodium. Look at the salt, the sodium salt of Diclofenac. The brand name is Voltaren. Now, they make a tablet form and a capsule form of Diclofenac potassium that's called Cataflam. This is easy to get those two twisted. Sodium is Voltaren, potassium is Cataflam. And this is indicated for pain. Some of the side effects would be photosensitivity, swelling or edema, nausea, increased blood pressure, and decreased renal clearance. The black box warning for this, you can see it, is a GI bleed, and cardiovascular risk is there as well. We also want to make sure we take this in the capsule or tablet forms with food to limit the nausea and the GI risk. Another NSAID is indomethacin, which is the generic name for Indocin, capsule form. And its common indication is pain. It has the same side effects as the Diclofenac. So make sure that you look at those and you counsel your patients on these. Another NSAID is Ketorolac. The brand name is Toradol. There's also an injectable Toradol that's not on this slide, but it's an injectable Toradol. It's for pain, and the side effects are photosensitivity, swelling, nausea, increased blood pressure, and decreased renal clearance. Now, this drug is so important to follow this. You need to tell the patient to make sure they take up the food to limit nausea and GI bleed. This has a high risk for GI bleed. So the maximum day or duration of this drug is 5 days. 5 days. And make certain that you stay within those parameters. If a practitioner asks you, you want to tell them 5 days max. Another NSAID is meloxicam, which is the generic name for Mobic. It's indicated for pain, and the side effects are the same as the other NSAIDs: photosensitivity, edema, nausea, increased blood pressure, and decreased renal clearance. All of these need to be taken with food to limit nausea and stomach upset. Again, black box warning, GI bleed, and cardiovascular risk. Another NSAID, Nabumetone, brand name Relafin, indicated for pain. Same side effects, same black box warning, same note to take it with food. Another non-steroidal anti-inflammatory NSAID is naproxen, which is the generic name for naproxen, and also naproxen sodium, Anaprox, and Aleve. Aleve is over the counter. And this you can tell the brand name naproxen, naproxen, and Anaprox. Now, Aleve, I really can't help you there, but it's over the counter, but it is naproxen sodium. It's indicated for pain. There again, we have the same notes to take it with food to decrease GI upset, and also side effects are the same as the other NSAIDs. Black box warning, GI bleed, and cardiovascular risk, same as the others. Another NSAID is ibuprofen, which is the generic name for Motrin or Advil, indicated for pain with the same side effects as the other NSAIDs. Take it with food. Maximum dose is 3.2 grams a day for the prescription strength. Also note the black box warnings of GI bleed and cardiovascular risk are the same as the other NSAIDs. Now we have some other non-steroidal anti-inflammatories. They're a little different. They're COX-2 selective. And we have the first one, Celecoxib, which is the brand name Celebrex. It's indicated for pain. And if you look at it, it has the same side effects as the other NSAIDs. But this one's kind of interesting. You need to not give this to somebody that has a sulfonamide allergy. They can have a reaction to Celebrex. Important to note. But this one you do need to take with food to limit stomach upset, and you need to caution anybody, remember, that has a sulfonamide allergy. Moving along to sedative hypnotics. This is a Schedule 4, which means it has less abuse potential than the 2 or 3. Now this name is going to be a tough name to pronounce. So here we go. Here's my southernness coming out. Azopiclone. The brand name is Lunesta, and it's used for insomnia. And of course, the side effects are somnolence, dizziness, ataxia, headache, and parasomnias. This drug, you need to make sure you tell your patients to avoid alcohol and make sure that they know that if they're taking other sedating drugs, they can have additive effects. It can increase that. It carries a risk of CNS depression also. Another sedative hypnotic that is a Schedule 4 is zolpidem tartrate, brand name Ambien or Ambien CR, indicated for insomnia, and the side effects are the same as the others. One thing about this one, it can cause some complex sleep behavior. Sometimes people that take this get up in the middle of the night, they don't know what they are doing. They might go and eat something, they might hallucinate. So you, especially with older folks, this is something that really needs to be thought out if they tell you they've had some weird things happen. I like to ask them, if they have somebody they're living with, make certain that they also will tell them that they're taking this medication for sleep. I think that's important. All right, let's look at a serotonin reuptake inhibitor, antagonist, antidepressant, trazodone. Brand name Deserel. Common indication is depression, but it's used a lot for insomnia. Side effects, sedation, orthostasis, and priapism. Sometimes with this drug, it needs to be taken at bedtime, and it needs to be taken for 1 to 2 weeks to feel the exact benefit, especially with depression. But with insomnia, it generally works a little bit more quickly. A couple of things we need to talk about to our patients, that it can increase the risk of suicidal thoughts in the first few months. Very important to talk to your patient about that. If they have any thoughts of suicide, they need to stop that drug right away. Alpha-2 antagonist antidepressant, mirtazapine. The brand name is Remeron. It's used for depression, insomnia, and as an appetite stimulant. Some of the side effects would be sedation, increased appetite, which is why it's an appetite stimulant, and weight gain. So this one can be taken at bedtime, and if we're using it for depression, it can take 1 to 2 weeks to get the full benefit. But also this one has the increased risk of suicidal thoughts in the first few months of treatment. So make sure we talk to our patients about that. Here's a dopamine norepinephrine reuptake inhibitor antidepressant, Bupropion, which is the generic name for the brand name Wellbutrin, and there's a Wellbutrin SR and a Wellbutrin XL. It also is used for depression, insomnia, and as an appetite stimulant. Some of the side effects would be insomnia. Some more side effects would be tremors or seizures, and also weight loss. Now wait a minute, that doesn't all add up, does it? But it depends on your patient, okay? And they found benefit with this with depression, insomnia, and as an appetite stimulant. But look, It can also increase the risk of suicidal thoughts, and it can lower the risk of sexual dysfunction, and it too can take 1 to 2 weeks to see the full benefit, especially if we're using it for depression. Serotonin norepinephrine reuptake inhibitor, antidepressant. Here's another one, Desvenlafaxine, brand name Pristique. The common indication for this drug is depression and fibromyalgia. Some of the side effects of this drug are sexual dysfunction, anticholinergic side effects, and weight gain. Remember when we talked about anticholinergic side effects earlier? Dry everything, dry mouth, dry eye, dry nose, and constipation. Very important. When we say anticholinergic side effects, we know what that means. Your patients may tell you they have something in their stool. That would be a ghost tablet. And I would let them know that before they go to the bathroom and think something is up, okay? We need to counsel this before they take the medicine. This also has a black box warning of increased risk of suicidal thoughts. So we need to let them know that as well. Serotonin norepinephrine reuptake inhibitor antidepressant, Duloxetine, brand name Cymbalta, is used for depression and neuropathic pain. Side effects, sexual dysfunction, anticholinergic side effects, we talked about those just last slide, and weight gain. Black box warnings, suicidal thoughts in the first few months of treatment are possible. Also important to take this at bedtime. One note about this drug, it has an increased risk of bleeding if taken with NSAIDs or antiplatelets. So avoid that with this drug. Serotonin norepinephrine reuptake inhibitor, antidepressant, venlafaxine. Notice it looks kind of like the other one, but it's different. Similar, the root's the same though, isn't it? Brand name is Effexor, and it also is used for depression and neuropathic pain. Has the same side effects as the dexvenlafaxine and the same black box warning. Everything is the same. Selective serotonin reuptake inhibitor, or an SSRI antidepressant. Generic name is Citalopram. The brand name is Celexa. It's indicated for depression or anxiety. Side effect, sexual dysfunction, somnolence, weight gain. It can take up to 2 weeks to get the full benefit, and then 6 to 8 weeks for the full effect. You need to tell your patients this, because what happens if you tell your patients, you give them the medication, you tell them the side effects, and you don't let them know it could take a couple of weeks to start helping them? They'll quit taking it. So this is very important. Selective serotonin reuptake inhibitor, SSRI, antidepressant. Okay, this one looks familiar because look at the root, citalopram, but this is S-citalopram. So it's very similar to the one we just looked at, citalopram. The brand name for this drug is Lexapro, but it's very similar to the other drug, citalopram. Its side effects are the same, the indications are the same, depression and anxiety. It also can take a couple of weeks to get full benefit and 6 to 8 weeks for full effect. And one thing about this drug is not to exceed 10 milligrams if you're over 60. Black box warning is also the same. Here's another SSRI antidepressant, fluoxetine. Brand name is Prozac. It is indicated also for depression and anxiety with similar side effects or same side effects as the escitalopram, citalopram. It also takes a couple of weeks to feel the full benefit, and it has the same black box warning, fluoxetine, Prozac. Another SSRI antidepressant is paroxetine. The brand name is Paxil, and it too is indicated for depression and anxiety with the same side effects as the other SSRIs. Same note, may take a couple of weeks to feel the benefit, and same black box warning. Paroxetine, Paxil. You can kind of see this root in the branded product. Just fun fact. Selective serotonin reuptake inhibitor, SSRI, antidepressant. Sertraline. Brand name is Zoloft. It is used for depression, anxiety. It has some side effects as the other SSRIs, sexual dysfunction, somnolence, and weight gain. It also takes a couple of weeks to get the benefit, and it has the same black box warnings. We're going to go to something a little bit different. It's an SSRI 5-HT1A partial agonist antidepressant, Vilazodone. The brand name is Vibrid. And notice that's Vibrid with 2 I's, not 1 I. That is not a typo. Vilazodone, brand name Vibrid. And it's indicated for depression. The side effects would be sexual dysfunction, insomnia, nausea, vomiting, and diarrhea. This can take a couple of weeks to feel the benefit and 6 to 8 weeks for the full effect. This also has the same black box warning as other SSRIs, increased risk of suicidal thoughts in the first few months. So make note of this. It also has a bleed risk with anticoagulants or other drugs such as NSAIDs. Let's look at some other antidepressants or TCAs. Amitriptyline, brand name is Elavil. And you know what I think about this? It's an antidepressant, Elavil, to elevate your mood. I don't know, that always helped me. But it's used for depression and neuropathic pain. Amitriptyline is used for a lot of things. They use it a lot of times, sometimes for migraine prevention at a lower dose. But it's an older drug, and it's a good drug. But you've got some side effects: QT prolongation, anticholinergic effects, weight gain. And this too can take a couple of weeks to feel the full benefit, and you've still got that black box warning of increased risk of suicidal thoughts. So important, important, important. Another TCA is Doxepin. The brand name is Selenor or Silenor. It's indicated for depression. Side effect is the same as the other TCA, the Elavil or amitriptyline we talked about last. QT prolongation, anticholinergic effects, and weight gain. Also, 2 weeks to make a difference in the effect and interaction with QT prolonging drugs. Black box warning the same, increased risk of suicidal thoughts. Another TCA is nortriptyline. Notice the triptyline, just like the amitriptyline. Brand name is Pamelor. It is also indicated for depression. Same side effects as the other TCAs. Same precautions. Don't take it with QT prolonging drugs. Takes a couple of weeks to feel the benefit and increased risk of suicidal thoughts. We're going into another class of drugs, the NMDA receptor antagonist used for dementia and Alzheimer's. Memantine is the generic name for Namenda. I can remember that because memantine, the N, Namenda. And you can remember that by remembering maybe the name, if you can remember your name, memantine. Some of the side effects of this drug: dizziness, confusion, constipation, headache. And this drug can be sprinkled over applesauce or pudding. It's okay.